I'm gonna squeeze these together. If you have any kind of lower lumbar back injury, he's gonna writhe in pain because he's gonna feel it because he's putting torsion on his lower back. He will feel lower back pain. If there's anything on, he'll feel it when you do that. So that's a little bit more advanced, but that's something you can check.
Okay, so that's his back pain?
Yeah.
And then what if, like, is it?
Then he can scream all he wants.
You can also,
Yeah, you're just checking. You're just being more thorough.
Straight, they're good. That's it. That was it.
Yeah, just looking at hips and a lumbar, and towards pelvis instability.
That one's supposed to be up there, and then you come along
Okay,
with that.
so I'm holding C-spine.
Okay, so.
Yeah, make sure it goes right above.
And right now I'm checking for any kind of step off into the spine, right?
But that's how it will be, right?
Yeah, this is right above the ankle strap.
Right with the ankle, is it 2 below the knee, 2 above the knee?
Yeah.
And that. Perfect.
Okay.
When you put the kickstand back at the end, or I think once
right
you get
once the leg
Once you have that strap on, then you take it out.
Okay, so let's look at what we're doing. Let's hold on. Let's look at what we're doing. Which way?
Yeah, I'm doing everything.
Are you going to be able to roll him back? Do you have a lot? Do you have a lot of room? Okay, so what? And pretend this is a block wall. So what would work best? What do you guys think would work best? Which side? Put the backboard in over here and roll him towards the other one. You know what I'm saying? Yep. I promise, it'll work. Okay. Now, you have a little bit more room. Okay, so what you want to do is you got the backboard? You're going to need another set of hands over here. Yep. So somebody else jump in, I'll show you guys what you're going to do. So you're going to grab him right here. You're going to grab him right here. Your left hand, cross his arm. And then down by his ankles. Why do we do that? You guys see what we're doing? You got to cross arms like that. You guys see what the whole side of the body? Yeah, he's not yeah, look at because you're preventing, because what if they're off a little bit, now we just took him to the chiropractor. Because if you twist and he doesn't move, he's like, ah! You know, that's not cool. We're trying to avoid that. So now their arms are crossed, so they're going to move in unison. And who's going to call it? I will. Okay, so what I'm going to do is I'm holding the C-spine still, and I'm kind of out of the task now, but I'm going to call all the shots. Okay, so on the count of 3, we're going to rotate towards you guys. All right, sir? 1, 2, 3. Rotate him up. Now check his back. All the way from the occipital area, all the way down to the butt. Noting for any decap, ETLS, feeling for step-offs, anything like that, okay? All right, on the count of 3, roll him back on the board. Here's another little trick. The board all the way up. 1, 2, 3. Okay, what happened? I'm going to send you back up, okay? Come on back up. So one of you guys has to have your hands underneath his head. Other way. Like scooping him up. Okay. Does that make sense? Okay. Count of 3. 1, 2, 3.
He's going to be halfway on the board.
Yes, he is. We'll reposition him, but we're trying to mitigate any more further movements. So 1, 2, 3. Lift like a pass. Okay, so normally we're not going to reposition him that way. If he's off the board a little bit, one of the students had a view of the Z. What we're going to do if he's off like this is one of you guys is going to grab him by his hips or by his waistband, and someone's going to grab by his shoulders, and we're going to go down and then back straight. Okay, so one of you grab by his waist strap or his pockets or something like right here. And you grab him by his shoulders. Okay. And I need you to put your foot on the backboard. So do that. You put your foot on the backboard. There you go. So on the count of 3, we're going to move him down and we're going to reposition him up. Okay. 1, 2, 3. Down and back up. 1, 2, 3. Done. Right there. Go ahead and start strapping in his body. I'll keep holding the C-spine.
This call was for a guy who fell off of his skates and had back, neck, and head pain.
Okay, so you lift up down there and he's going to close the straps, okay?
sit? You wanted it? Okay. Which leg's towards the water? Your right leg? Alright. Play manual first. So right leg.
I was like, is that tight? Is that tighter? Good. Sorry, can you breathe? Then this tape's going to do this. I'll just use the tape and show you what it is.
So right here. So right where the.
Sorry.
Okay, now you do grips and pushes. If you have more tape or you need more tape, you can use it right here over the forehead or right the eyebrows. If you want. Yeah, landscape over here.
Pull up on my feet, and your hands, push down. Kind of like pushing.
Big.
You wiggle them as well.
Is there gonna be more straps too, most of the time?
No,
Like
minimum
the
with
waist
3.
and then, oh, okay, there's 3.
Minimum with 3. Every backboard, however you strap the backboard, it's different.
Okay.
So whatever you guys do, if you work for care ambulance, there is a certain way they do it. On the fire department, we have 4.